When you have back pain, there's certain things that you might be doing wrong. Matter of fact, I hear this all the time, and this is the truth. Patients are doing certain activities that were prescribed by a therapist or a chiropractor or their doctor or their medical doctor, and they're actually making their back worse. And there's a reason why they're making it worse. And there's also a reason why they're getting the wrong exercises, because they're just not doing the right thing, but that's a different story. So here's step one. If you have back pain, this is where you start. This is how you eliminate your back pain. Very important. And it's also the first step, the most important step, but it's also the step that nobody pays attention to, because it seems too easy, or it's not working fast enough, or it's not for me. This is where you start. First of all, where you start is understanding the cause. We're going to talk about the cause, and we're going to talk about what you can do right now to start making your back pain better. It's not hard. It's only hard when you don't understand it, or you're getting confusing information from everybody, from your doctor, from your therapist, from the internet, from your neighbor, from your mom. Everybody gives you information that is probably not 100% accurate. And sometimes they're giving you flat out the wrong information. So the key is to understand what it is, and then what causes chronic back pain. You've heard this, and if you haven't heard this, today's a good day to start. Typical spine looks like this. Now, it doesn't matter what you call it. Doesn't matter if you call it a herniated disc, a bulging disc, or a degenerated disc, or stenosis. They're all variations of the same problem. It's the spine is slowly breaking down as a result of something that you're doing, and sometimes it's just sitting. It causes it to break down, and it perpetuates the problem, and your back pain doesn't go away. So it doesn't matter what you call it. You can call it all those different things. There's a way out. Doesn't matter if you have stenosis or sciatica or herniated disc, there is a way out. Typical spine looks like this: 24 vertebrae between the head and the hips. The vertebrae are the bones. In between each bone, there is a disc. The disc allows for motion of the spine. And the disc is a lot like a jelly donut. Inside the spine is the spinal cord. So the spinal cord runs down through the inside, starts at the brain, comes off the brain through the inside, and then there's a little nerve that exits between each of the vertebrae through an opening called the foramen. And it's not uncommon that when you have a pinched nerve, it gets pinched right here at that opening of the foramen, and it's pinched by the disc, because that space is created by the disc. Spine's on the inside. What happens is sometimes those nerves can get a little aggravated, causing pain in the neck that goes in the arms, or pain that is in the back that goes down the legs. The disc is like a jelly donut in the sense that the outside of the disc, there's a thick material. Inside the disc, there's a jelly. The jelly can move a little bit. What happens through everyday activities is the jelly starts to move. And sometimes if you sit too long, or you're bending wrong, or you're doing certain activities, that disc will start to push out. As it starts to push out, it's going to aggravate the annulus. You'll develop an inflammatory process, and the inflammatory process causes a little bit of pain. And the more inflammation, the more aggravation, the more pain you have. But what happens is the annulus starts to tear. And as it starts to tear, the nucleus will start to push to the outside. As the nucleus starts to push to the outside, you develop a bulging disc. Sometimes what happens is you develop the herniated disc as it pushes out further. Sometimes it'll push all the way through. As it pushes all the way through, you'll very often start to pinch that nerve. This is the nucleus pushing through. The nerve is here. Pain goes down the leg. Sometimes it's just pain here, but sometimes the pain goes all the way down the leg. And it really kind of depends on how much the nucleus is pushing out. Is it a bulge? Is it a herniation? Is it a sequestration? What is it? Okay? But again, it doesn't matter because it's all about this process where the nucleus is going to push out. Now, we did a study using MRIs, 5,000 patients, MRIs. We had them stand up. So with an MRI, you can physically see the disc when you stand up. You can see that sometimes standing up caused a shifting of the disc. Sometimes it caused the shifting of the vertebrae. The spine wasn't working the way it should. So we did weight-bearing MRI, and then we had patients bend, and we analyzed the vertebrae motion in conjunction with the size of the disc. And what we found was sometimes what happened is when patients bent forward, their disc got better. The herniation got slightly better. And sometimes when they bent forward, the herniation got slightly worse. It pushed out further. And this pushing out further corresponded with their pain. Yeah, it feels worse as it pushes out further. Or they bend forward and it gets better. They say, you know what? I feel a little better in this position. Same thing when they lean back. Sometimes the disc would push out further. They would say, yeah, that hurts worse. And sometimes the disc would physically get smaller and they'd say, yeah, that feels a little bit better. So it corresponded with the motion and the pain that they had as a result of the motion. This was a major, major, major breakthrough. Again, we did all the MRIs standing and then we had them bend. So it's this disc motion actually will cause the pain to get better or to get worse. But the problem is not everybody is the same. This was a major, major breakthrough. But what we knew was through this motion, you could actually make the disc worse. And as you're making it worse, you're aggravating the tissues and they're becoming more inflamed. You're developing more inflammation in and around the disc. And this inflammatory process will start to sensitize the tissues. It's the same as if you have a hammer and you hit your thumb with a hammer, it's going to get inflamed, your thumb. And then if you hit it again, it's going to hurt more than the first time because now this inflammation has caused the tissues to become more sensitive. And the longer that this is inflamed, the more sensitive it becomes. And you don't allow for the healing to take place. And it's kind of like if you cut your hand and you bend your hand, these tissues are never going to heal. The longer you have the inflammatory process going on inside the disc, the inflammation starts to become destructive. If it doesn't actually get to the healing phase because you keep aggravating it, the longer you aggravate it, it becomes destructive. And the tissue actually starts to break down. So you get a breakdown of the annulus. But also what they found is this chronic inflammation as a result of the motion in the discs will cause the nerves to become more active. And you'll develop inflammation inside the nerves and inside the spinal cord. And this inflammation then causes the nerves to become hypersensitive. So a motion that may have only hurt you a little bit now hurts you a lot. And this is the pain that doesn't go away. And this is the pain that's perpetuated. It's this ongoing activity inside the disc that gets aggravated as a result of the motion. The problem is the spine is very, very, very dynamic. There's 24 vertebrae, all designed to move. Okay, every activity that you do throughout the day is loaded on that disc with some motion. That's what perpetuates the problem. The key is there's a way out. And it's not even that difficult. You just have to understand what it is. But what is it? It's the mechanical irritation to the joint moving causes the pain. It's the compressive load. It's the abnormal movement. It's the postures. It's all the things that you do throughout the day that maybe aggravate that disc. And those are the things that when you identify what they are and you start to avoid them and add in better motion patterns, then the inflammation comes down and the sensitivity comes down. But it's the continued inflammation because you're moving wrong, because nobody ever told you you're moving wrong, or you're sitting wrong, or you're sitting too long, that then you start to get the aggravation. So it's the poor posture and it's the faulty movement habits that really become habits. These are things you do every day, and you think you don't even do them consciously. You do them unconsciously. The way you bend to brush your teeth, the way you bend to get in and out of a chair, in and out of your car, are all habits, but they're all going to cause the inflammation in the annulus, and it's going to hurt. Say, oh, that hurts, that hurts, that hurts. Okay, it's a combination of all those. So you really have to eliminate the motion patterns that are causing it, and everybody is slightly different, which is what we identify by using the MRIs. But the key is better posture and healthy movements. If you sit too long, you're going to start to have a problem. So there's a way to resolve that by getting up and moving around, which is one of the tips that we have. Okay? But again, it goes back to what is it that's causing the aggravation to your disc? We have a questionnaire that we have you fill out. Okay, and through this questionnaire, you're able to identify what your patterns are. And then from these patterns, we're able to identify what exercises you need specifically. It's the wrong exercises in the past that perpetuated the problem.